Welcome to Gracefully Graying. I am co-founder Lori Bloom. Explore a platform of tips, trends, news, and informative discussions for you and your loved ones. Whether you're 50 and over or way over, find us on gracefullygraying.com, YouTube, and social media. Enjoy this live stream discussion.
Good morning. Hi, I'm Pam Lippitt with Gracefully Graying, and it is my pleasure this morning during Heart Month to welcome Dr. Stephen Korotkin, who I have known for about 30 years, I guess.
31 years.
Yeah.
Right.
Oh, you did your homework. With all full disclosure, Steve was my dad's cardiologist, and you gave him probably an extra 30 years of his life. We in my family, we credit you. So not him, you.
Thanks.
Against his best intentions, you. Today we're sitting in the exact middle of Heart Month. And so we thought it would be good to share with our audience a little bit. You can tell us a little bit about yourself, why you're still working full time. And then we'll go in and talk about some things that our audience might want to know. So welcome.
The reason I work full time is easy. I love my job. Cardiology is the most fun job you can have. And it's interesting. You make people better, and I like meeting the patients. I like my staff, but I have the best patient population of any doc I know. And so I like it. I look forward to going to work every morning. And I say the same things to people that they've always heard. Same thing I'm going to say now. The way to keep from needing a cardiologist is basically, you can't choose your genetics. So the way to keep from needing a cardiology is to be, strict on your diet and religious on your exercise. And as far as diet goes, there's, I think most men, I tell them that they should never have a second helping the rest of their lives, and because they eat too much. And
I do recall when you told my dad that, who told you you need butter on bread?
Right. But I think that, when we were growing up, I'm 74. When we were growing up, when we could afford to go out to eat, we got a little tiny hamburger and 7 French fries and a little Coke. And that was it. Now you get a huge hamburger and a whole plate of French fries and a giant Coke. And so people overeat. And then that's not even enough. Then they have to take more. They eat the rest of their kids' French fries or their dates' French fries. And so weight control is important. I think the only thing that people should totally eliminate from their diets is fried foods. Fried foods are bad. They're usually they're fried in nasty oil, but just the frying. When you fry something, you change the fats to trans fats. It becomes much more likely to cause blockages than just the saturated fats. And so I think that there's so other things I'd have them reduce. I think that meat products, dairy products, and desserts, they should be judicious about using, but fried foods they should eliminate. Smoking, obviously, there's no reason to smoke these days. If you want to use marijuana, it's okay with me, but eat it. Or use it topically. Don't smoke it.
Oh, that's interesting.
And I think that exercise is important.
I want to go back to the fried food. What's your take on these air fryers then?
Well, I think that, actually, there's not been a study that I know of that assesses whether air frying causes the same changes in the fats as regular frying. I don't know a study on that. And so, the fact that there's no oil makes it better or less bad, but I don't know if it still changes the whole aspect of frying. I don't know.
Okay, interesting. All right, so tell me the beginning, like when you went to med school, were you always going to head toward cardiology?
No, I started out as a surgeon. I have a surgeon's personality, and I'm cocky, I'm impulsive, I like immediate gratification, but I got sabotaged into the medicine aspect. And that's why I sort of gravitated toward cardiology, because at the time, you got to stick needles in people, got to wear your pajamas in the hospital, get a little blood on your cuff and things like that. And actually, I was born to be a cardiologist. I love cardiology.
You were.
And it's everybody has a heart. Everybody needs to take care of their hearts. And so, I think that I tend to ask people, and sometimes I get joking answer. Sometimes I get true answers that surprise me. But ask people, how many days a week do you brush your teeth? And most people say 7. They say twice a day, or they say 7 days a week. And I ask them, what's more important in your future health, happiness, and survival, your teeth or your heart? And they always say, sometimes they say both. Sometimes they say, is that a trick question? But then they come up with heart. It's more important. So I say, on the days you brush your teeth, you should exercise. And
Okay.
I told them that there are 3 exceptions that I tell them. One is, if you have a fever, you shouldn't exercise. Other is, on the day of your daughter or granddaughter's wedding, you may take off. And I also
that's
say
so
the day after
kind
the
of
Lions won the Super Bowl. And so, see, my little brother is 6'1". My mother was taller than me. My father was taller than me. My cousin, who just recently died, was taller than me. My cousin, who's still alive, she's taller than me. And before my bar mitzvah, my mother told me I'd hit my growth spurt someday. I know my mother would never lie to me. So I know the triggers me. When the Lions win the Super Bowl, I'm going to grow. I'm probably going to be 6'4" someday.
You're still waiting. You're still
Yes.
waiting.
Yeah.
So, I don't want to tell you get shorter as you get older. So
that's happened to me as well.
Yeah.
Yes. But when the Lions win the Super Bowl, it's going to reverse.
Okay. All right. Soon, maybe next year, from your mouth.
Yes.
Okay. So let's talk for a few minutes about like the 101. Most people go to, hopefully most people go for an annual exam to their primary care doctor, or their family care doctor. When does someone make a decision, aside from a catastrophic incident? We'll talk about that in a minute, but when does someone make a decision to
let me back up and tell you that most of your viewers will remember Vietnam War. In Vietnam, I got to do autopsies on almost 10,000 American boys. Average age was 21 years, 2 months. Now, a higher percentage of the soldiers that were autopsied were smokers, but at age 21, I think they've been smoking 4 years. More than 75% of the GIs had some coronary disease. 25% had a blockage of significance in at least one coronary vessel. So if your chance is 25% at age 20, add 10 years to women, so 25% at age 30, what's your chance going to be at age 60 or 65? And if you take 100 men, the numbers are similar in women, not quite as clean, but if you take 100 men who have coronary disease, who develop symptoms, the first symptom 35% of the time will be angina, chest pain with exertion. 40% of the time, the first symptom is a heart attack, and 25% of the time, the presenting symptom is death. And so certain, it depends what your genetic predisposition is. If your father had a heart attack or your uncle had coronary disease, grandfather, that puts you at higher risk just because And, is your sugar normal? Is your blood pressure normal? And what most people think of, what most internists call high blood pressure is 140/90, when in truth, that's way too high. I mean, 120/70 is normal. Between 120 and 130 and 70 to 80, there's a 1.4% increase in atherosclerosis. But 130 to 140 to over 80 to 90, there's an 18% increase. And so, so 140/90 is high, but that does not mean that 139/89 is normal.
Correct.
So
it means it's on the edge.
Pardon?
It means it's on the edge.
Right. Well, it means that you're in higher risk at that point. And people talk about cholesterol, I talk about HDL cholesterol, and whether it's small, dense LDL and things like that. The number that most people should remember is the non-HDL. HDL is the good, everything else is not good.
Right.
And so, ideally, the non-HDL cholesterol should be below 65. Our goal is below 90. And over that, your risk is higher. I think that, so probably 40 to 45-year-old men should have a baseline stress test. 50 to 50-year-old women should have baseline stress test. I think that the calcium score has changed things a little bit. But if you have a positive calcium score, now I'm 74, I have a 0 calcium score. Right. That doesn't mean I don't have coronary disease. It just means that the coronary disease that I have, if I have any, has not been calcified, has not been there long enough to become scarred. And now I have zero cholesterol buildup in my carotids and the arteries going to the brain. So that's a reassuring thing. Because if you have coronary disease, you may have carotid disease. If you have carotid disease, you always have coronary disease. coronary blockage.
Okay, say that again for
So
everyone.
if you have some blockage in your carotids, you always have some in your coronaries. May not be significant, but you always have some.
Okay.
And since if you have some and you develop symptoms, it's something that could be catastrophic. And so people should be aware of what the risks are and then what to do about the risks. I mean, I think that's the, keeping your weight down, eating the proper foods, watching your cholesterol, your sugar, your blood pressure, not smoking, and because we can't change our genetics, and then and exercising. Okay. I like the fact that you flashed that on the screen.
Do you? It's a classy move. That's why we use this program.
Yeah.
So what do people watch out for? What if, this is not a surprise. We'll go first person here. My dad was very lucky. He actually had a horrid heart attack, but he was in the dentist chair. So he had oxygen immediately. And they say that's probably what saved his life. And then he met you, which continued to save his life. Yeah. Who continued to save his life. So what are things people should be watching out for and I think take action on?
Change in your exercise ability, your exercise tolerance. That can be a harbinger of a future event. I mean, I think that before people have heart attacks or cardiac arrest, sometimes they have a few weeks that they notice that things just aren't right. Now, I don't want to make people, just because they feel down today or things aren't there, they don't want to say, oh, I'm going to have a heart attack. But I think that's something that you even notice that all of a sudden your ability, if you're vacuuming the living room and you get tired today and you get tired tomorrow and you weren't tired before, that's a reason to think that maybe there's something different ongoing. Now, if you have a calcium score of over 100, that's significant. Over 400 is definitely mean you have a lot of atherosclerosis. If you have a zero calcium score like me, does that mean I can't get a heart attack, can't get coronary disease? Nah. My lifestyle makes it so it's unlikely, and my family history makes it so it's unlikely. But I think that just one piece of datum doesn't make doesn't give you an allegiance to a positive diagnosis or a negative diagnosis.
It's everything put together.
Correct.
So when they say sleep is really important, right? What do you say to them at that point? Mister, I get up at 4 in the morning.
I've just been reading about this recently, not for this presentation, but there are people, probably they say about 3 or 4%. Most people need 7 to 9 hours of sleep. Kids need more than that, but there are about maybe 3% of people who don't need that much sleep. And I'm fortunate in a way because I get up at 3:45 without an alarm, and sometimes I get up earlier, but I just don't need that sleep, and I'm lucky because I think that people, I can't give you a quantification that if you don't get enough sleep, you're more likely to have a heart attack. But there's data that says if you don't get enough sleep, maybe your brain doesn't function as well, maybe your heart doesn't function as well. I can't say that your kidneys won't function, but I think that older people have trouble with their bowels, and if they don't get enough sleep, bowel problems increase as well. So I think that sleep is a minor factor, but it is a factor. And
yes. I know that, we had to see you in the hospital. You had to be there really, really, really early in the morning. Most of us get up at 3:45. We're just smart enough to go back to sleep. That's the difference. So, all right. So signs to watch out for. You talked about, listen to your body, listen to yourself. If things feel
any
wrong,
pain between the waist and the eyes could be heart pain. So heart pain is predictable. I have one patient, interesting, he had pain in his left wrist. He went to an orthopedic surgeon, took some x-rays and examined it looked fine. Still had pain in the left wrist, went to a different orthopedic surgeon, took some more x-rays, examined it looked fine, but sent him to a rheumatologist who drew some labs and said it's not lupus, but got the history that he had this pulling the cart up a hill on the golf course. And so he thought it was something muscular, but he sent him to me, and on a stress test, this man had chest pain radiating down the arm to the wrist without the chest pain radiating down the arm. So the wrist pain was his angina. He had a stent, an angioplasty stent, put in the artery down the front. His wrist pain went away, and so
Wow.
that was his. That's an unusual presentation, but heart pain is usually predictable. You're not having a heart attack. Usually, it's if I'm doing this activity, I'll get the pain. I rest, it goes away. Tomorrow I'll do the same activity, I'll get the same pain. I have another interesting patient. He used to get angina. He used to get chest pain 2/3 of the way cutting his grass. I wanted to take nitro before he cut the grass, but he never would do that. One day he got angina about a quarter of the way through, had it again halfway through, and instead of going to the hospital, came to the office, did an ECG, I sent him to the hospital, and he was on the verge of having a major heart attack.
Wow.
Just from the change in his angina. His angina was stable and became unstable, and
Okay.
he didn't have a heart attack, but because he recognized that there's something that changed.
So define angina for us.
Angina is chest discomfort with exertion. It's the
Okay.
sometimes it's difficult to describe sometimes, and people, it's not a sharp pain, it's not a burning, it's a tightness or just a pressure or just a feeling of discomfort while you're exerting yourself, but it's predictable. I shovel the wall. Things that make angina occur in people who are prone to get it: cold weather exposure, eating, emotional upset, and activity. So another patient, this guy had an argument with his wife after dinner, was taking the garbage out on a Thursday night. It was colder than it should be, and that's when he had his heart attack. He just eaten, was having emotional interaction with his wife, and it was cold, and he was taking the garbage out. And so those things together pushed him over the edge to have a heart attack.
Yeah. Well, this is really interesting. I think your bottom line is you have to listen to what your body is telling you.
Yeah.
And act on it.
Yeah, just don't ignore what your body says.
Do everything you can in advance, but if your body is speaking to you, don't ignore it.
I agree with you. Great.
Yeah. So,
okay.
And so you are still working full time. You are still taking patients. So we're just this is your website and your office. Yeah. And your office phone number if someone wants to connect with you. You do have somewhat of a presence on social media, but we won't go there for now.
Yeah.
Not much. The best way is to call.
That's right.
And I will say that this has been really helpful, I think, for our audience, not only for people who are feeling this way, but a big part of our watchers are people who help take care of their loved ones and watch out for their loved ones. So it's something interesting to watch, to just be aware of when you see or take care of your family members.
Just about everything I said, except the statistics, is logic. People know this stuff anyway. They know they have to eat. I mean, I use the example. I don't know if you know how Germans keep their beer in these huge 12-foot diameter kegs. If you threw a marble down one of those kegs, you could spend an hour looking at that. You couldn't find it. If every week or two you threw in another marble or two, after a year you wouldn't be able to see it. But after 4 years, 5 years, you had some collection. After 6 or 8 years, you'd be able to see them there. Well, I think that's the same thing when you cheat on your diet. Well, I've been good all week, so Weight Watchers says I can cheat on Saturday, so I have pile of
Weight Watchers doesn't say that, by the way. Just saying.
Pardon?
Weight Watchers doesn't say that.
Okay. All right. Well, but anyway, but I'm saying that if you cheat on it, that's just another marble added to the vat. And so every time you cheat, it usually doesn't go away.
Okay. Well, you've given us a lot to think about. It is Heart Month, but Heart Month really is all year long. And taking care of yourself is all year long.
Right.
So I want to thank you. I haven't seen you in about 10 years. 8 years. So this was really good to at least see you across the screen. And we want to thank you for joining us this morning. And
you're welcome.
Hopefully people will learn and take heed of your messages. So thank you very much.
You're welcome.